Episode 6: Why Some Specialties Are Paid More Than Others. Welcome to Medicine, Dollars, and Decisions, Life and Business in Medicine. I'm Dr. Bruno Casanova. In this episode, we'll talk about why compensation differs so much between specialties and why the value of an RVU is not the same for everyone. Let's start with a question that almost every medical student, resident, or attending has asked at some point. Why do some specialties earn significantly more than others? And perhaps even more confusing, why can two physicians generate the same number of RVUs and still have different incomes? To answer that question, we need to understand an important concept. Not all RVUs are worth the same amount to every employer. As we discussed in previous episodes, CMS establishes a Medicare physician fee schedule and assigns RVU values to medical services. We also learned that geography affects reimbursement through the Geographic Practice Cost Index, or GPCI. But there is another layer to the story. Hospitals, health systems, and private practices often establish their own compensation formulas for physicians. As a result, the dollar amount an employer pays per work RVU may vary significantly between specialties and between institutions. Why? Because different specialties generate different types of revenue. For example, primary care physicians spend most of their time performing evaluation and management services using E/M codes. Surgeons and procedural specialists, on the other hand, generate revenue not only through office visits, but also through procedures, surgeries, and facility-based services by using CPT codes. As a result, specialties such as orthopedic surgery, neurosurgery, gastroenterology, interventional cardiology, and others often generate larger volumes of RVUs than many cognitive specialties. But RVU volume is only part of the story. The other part is the dollar value employers are willing to pay for each RVU. Historically, some of the highest compensation per RVU rates have been found in specialties such as hematology-oncology, neurosurgery, and orthopedic surgery. At the other end of the spectrum, specialties such as family medicine and general pediatrics have often received lower compensation per RVU. Now, it's important to understand what that does and does not mean. It does not mean that a pediatrician is less important than a neurosurgeon. It does not mean that one specialty works harder than another. And it certainly does not mean that physicians in lower paid specialties cannot earn excellent incomes. What it does mean is that different specialties operate within different economic environments. A pediatrician and a hematologist-oncologist may each generate RVUs, but the financial value of those RVUs to an employer may be very different. As a result, a pediatrician may need to generate more RVUs to reach the same level of compensation as another specialist who is paid a higher dollar amount per RVU. So why are employers willing to pay some specialists more per RVU? One major reason involves the other two RVU categories we discussed earlier: practice expense RVUs and malpractice RVUs. Remember, physicians primarily focus on work RVUs, but employers receive reimbursement related to all three categories: work RVUs, practice expense RVUs, and malpractice RVUs. Together, these additional payments are often referred to informally as facility revenue or facility rates. These payments help cover the cost of operating a healthcare facility. They contribute toward equipment, instruments, supplies, nursing staff, office space, operating rooms, technology, and many other expenses. They also help offset malpractice insurance costs. Now, consider a surgeon performing a complex procedure. That procedure may require specialized equipment, expensive instruments, operating room personnel, anesthesia services, recovery staff, and significant facility resources. It may also carry a higher risk of litigation compared with a routine office visit. As a result, employers often receive substantially more total revenue from procedural and surgical specialties than they do from purely cognitive specialties. Because of that additional revenue, employers may be willing to pay those specialists a higher dollar amount for each work RVU they generate. In other words, compensation is influenced by much more than physician effort alone. It is also influenced by the economics of healthcare delivery, the resources required to provide care, the facility revenue generated by that care, the malpractice risk associated with that care, and the market demand for that specialty. That's why two physicians can generate the same number of work RVUs and still receive very different compensation. The RVUs may be identical, but the economics behind those RVUs are not. And that brings us to another important question. If compensation varies not only by specialty, but also by employer, how do hospitals and medical groups decide what constitutes fair physician compensation? How do they determine whether an offer is competitive? And where do those benchmark numbers come from? In our next episode, we'll discuss one of the most influential organizations in physician compensation, MGMA, the Medical Group Management Association, and how its compensation data shapes physician contracts throughout the United States. This episode is for informational and educational purposes only and does not constitute financial, legal, tax, investment, contract, coding, billing, or medical business advice. Listeners should consult qualified professionals regarding their individual financial, legal, tax, employment, contract, coding, billing, and medical business decisions.